Can you do it is a question, but should you do it is the better question. Hello, and welcome to this week's episode. This is episode 2 in the series on chemical peels and common skin conditions. And this week we're talking about chemical peel on hyperpigmentation. So we're going to do a deep dive. Yeah. We're going to talk about, can you do it? What kind of peel? What should you know? All the good stuff. Hi, Suzanne. How are you?
I'm good, Doreen. How are you?
I'm good. This has been an in-demand topic on chemical peels and skin conditions. So we are getting to another one.
Yes. I think on this one again, it's determining what type of hyperpigmentation, like what is your guesstimate on how they got this hyperpigmentation? Meaning, was it pregnancy and they ended up with the hyperpigmentation because of hormones that happen? Was it from acne, sun damage? Like there's a lot of factors what
Mm,
or yeah, sun damage meaning they weren't using any sunscreen or not diligent enough. Did they
yep.
actually, go on a vacation, and that could be skiing too, and they burned having that sun hit that area? Like there's a lot of factors to what is the hyperpigmentation, and try to figure out, okay, where did we get it from first? I think
Mhm.
it's a bigger part. And that's
And
why
I
I
think
even talk about
part of that
peels.
is, yeah, and part of that is understanding their lifestyle, right? Like they
Yes.
got it because of sun damage. Is that when they were younger and now they're more vigilant with their sun care? So it's kind of a two in one.
Yeah, for sure. And like I said, and more than likely, if they have pigmentation from acne, typically you're going to see a little bit of scarring too
Hmm.
in that area, typically, unless it was really new, like they just cleared up last year and they're left with these stains. Then that's different, right? But if
Right.
they're telling you, oh yeah, when I was a teen, I had acne in this area. Yeah, so I think like any chemical peel, like when you're doing these set up these treatments, is to really look at the brand. We always talk about the brand and the protocols that they have in place. Maybe you have more than one, because some are different than others. And that's what I love about it. You'd never combine these. We're not chemists. Don't mix and match your brands. And that's another thing that some people are doing, which is like, please be mindful of that, because, you're not the chemists that put this together. There's some brands that are, as we say in our world, like colorblind. So they're different. Like you're able to work on clients of different skin types, melanins, Fitzpatrick's, that type of thing, right? Mainly about Fitzpatrick's. But then you have other, we'll call them traditional chemical lines, that you cannot do a Fitzpatrick 4 or 5, like those are no's, or even a 1 maybe. So it's understanding your brand and what you have to work with too.
Yeah.
And then,
And
yeah,
like the percentage, the pH of your peel, like
and
all those
those
are
traditionally, yeah.
factors
Yes,
into
exactly. Yeah,
what you can or cannot use on who.
exactly. Yeah.
Hmm.
But I mean, glycolic is a big one. It's an AHA. The molecular size is very small, so it's going to go deeper. And then you're targeting, that radiance as well. But then you have to look at what their lifestyle is. And if they're not, when it comes to hyperpigmentation, if they will not be diligent with their sunscreen or hat. And some people say, oh, yeah, I golf, but I wear my sunscreen. It's like, would you be willing to put a hat on too? Because it's just a filter. Like, think
Yeah.
of sunscreen like your screen on a window in the summer. You put it on so the bugs don't come in and the other stuff. But those
I
little
think
bugs
so
can
too.
still get
Like
in.
with that though, like when you're doing a treatment protocol on somebody with hyperpigmentation, I would even like be more strict and ask for sun avoidance. Like don't you can't golf while we're
Absolutely.
doing this
Well,
treatment protocol.
any kind of, like, when you're doing chemical peels, even if you're doing low percentages, you still tell them. But some areas in where they live, they don't have the traditional 4 seasons, right? So
Mhm.
they have a very short winter, or and they're golfing right away in March, and so your window of the traditional chemical peel season is short. So how do you still work with people? And there's some people that go away in the winter for
Mhm.
3 months to a hot, you know, sunny country. So, you have to really look at, just because we're told it's peel season time, is your client good for it?
Yeah, and I think that that's just part of your assessment for considering chemical peel as an option for any skin condition is
Mhm.
really understanding not just what the condition is, but also your client's lifestyle and will it fit into a chemical peel treatment protocol. So
Right.
some won't, like we've just talked about, but I mean, some will, and they are dedicated to meeting their goals of whatever, reducing their hyperpigmentation, since we're talking about that today. But when we're talking about the different types of hyperpigmentation, so we'd mentioned like hormonal, right? Post acneic hyperpigmentation or scarring and sun damage. Are there different treatment protocols depending on the type of hyperpigmentation?
They're gonna vary a little bit because of more of the depth as well. Like if it's melasma, like the pregnancy, that's deep. And no matter what I've been told and researching is that it's so deep that really we as facial technicians, estheticians,
You can't treat.
we can't treat it to
No.
that degree.
And I think
Now,
understanding that and saving your client money and just saying, this is you need to go to a dermatologist
I've
for
seen some people do stronger peels and they're diligent on it. So was the client, and it wasn't 100% gone. That's the other thing. Like it faded, but knowing how deep it is the other aspect of that. But again, that would the people that are doing this, they have like dedicated their world into advanced facial treatments and they have taken many courses
Mhm.
and you could almost consider it the medical level but they're just not the doctor level. They've
Yeah.
maybe worked in a medical spa under the doctor, like, there's, so don't try not to mix yourself up into that. You don't know because one spa is offering, you know 70%. It doesn't mean because you can get your hands on it, because in this day and age you can,
Mhm.
doesn't mean you should be doing it. And I think that's the other side that we have to look at, is really distinguishing our boundaries of what we're able to do. And I've said this before, if you're not sure, talk to your insurance company. They're going to tell you.
Yeah. Yeah, that's a
They're
good
going to
one.
say, yeah, no, you can't go over 30% glycolic or salicylic or whatever it is that you're using on them. I know a big question we get these days is TCAs. Can I get TCAs in Canada? There's some changes that have happened over the years with, our what is it under our cosmetic
Oh,
government?
Canada?
Yeah, Health Canada. And because it's out there, yeah, because doctors can still do it. They can still do whatever they want with all of their products. But because you can order it and find it and use it, are you able to be covered under that and get it? Because some people have said, well, I can get it. That
Yeah. I think
doesn't change the rules.
you have to just stick to your training. Like, what are you trained on? How advanced is your training? Because there is, depending on where you get trained, you can get trained on, a
Oh,
chemical,
yeah.
peel, but you also can get trained on advanced peels. I think just stay in your lane and stay in your training. And when it comes to melasma, just understanding that there are some things we can't treat
Mm.
and deferring to a dermatologist would
Mhm.
probably be a wiser choice. But the hyperpigmentation that we can treat,
Is a lot more superficial.
it's more superficial, and then I think you can use really any, like you can use your glycolic, your lactic, your salicylic, but
Mm.
I think it would just what makes the most sense for what you're treating, right? So,
So for example, I'm going to use myself as one. I've always turned beet red with a glycolic, is how my skin reacts, which makes sense. It's smaller molecule. It's going to go in faster, deeper. My skin's lighter. I go rosy quick. I don't want to be rosy red. So my options that I like is the lactic. It's a slower way of doing it. I'm prepared to take an easier road, a little less
mhm,
flushing. That's not that I'm against glycolic in any way. It's a personal preference to get to know your client as well. It's not
yeah,
wrong to do glycolic. It's also, what does your clients want? I want to get back to work. I don't want to be explaining to people why I'm beet red everywhere.
yeah.
You just did a 35 or a 50 glycolic on me.
Yeah. And I think again, I think though that comes to your treatment protocol because when you're doing a chemical peel, like I would never start my client at the 35% glycolic, right? The first one is going to be your 10% glycolic.
Right.
After we've prepped your skin with home care for 2 weeks, then we do your 10%. So I can learn your skin because you can tell me all you want, but until I see it myself, like,
Yes.
right? Like it's kind of like, so I think it's just seeing it for yourself and understanding how your client's skin reacts. And then maybe you're like, no, let's do a lactic next and seeing how did that react. It
Right.
is it sounds like trial and error, but it's really just understanding where can you take how like pushing the boundary, but not the limit. Like you don't want to cross the line, but how far can we take the skin in a slow and steady manner
Mm.
to reduce that post-treatment complications that can happen? And you're talking if you're treating hyperpigmentation, you really want to go slow and steady. You don't want to make it worse and give them more hyperpigmentation.
Because that could be the adverse effect. Yeah. Is the response.
Exactly. Yeah.
Yeah. And then the recommendation of how often, if you're going higher with percentage, then you need more time in between. So 4 6 weeks apart, if you're doing like what, 20 or higher, would you say, Jareen? Even longer, depending on the client?
I would always start with the 10% and go
Yes.
2 weeks, and then sometimes, I mean, this we're getting a little bit more technical. You can go 10% again, but I'm leaving it on longer to see my intensity. Then I go 2 weeks, and then so it's really
There's
just
so
seeing
many ways.
how then if I'm gonna go into if I've hit like 35%, then yes, then we're gonna maybe push it 4 weeks. Then we'll so there's so many ways you can
So
increase
many ways. Yeah.
chemical peel intensity on the skin without actually changing the peel. You can use a cleanser beforehand with glycolic in it and still use your 10%. You can be more abrasive with when you're degreasing the skin and then use your so there's so many ways that you can increase
Absolutely.
without increasing, if that makes
Yeah.
sense.
And that's the other side of it. You're layering, you're building,
Yeah,
not just
exactly.
it's not just to, cleanse the skin and then you sweep them with a 50 glycolic. It's like you can do it slow and steady and
Yeah.
build and add on. And then it's more in control
Yeah.
of how the
Yeah,
skin is going to react to
if
it.
your client is doing a 10%, let's say, and that's like really light, but if your client's doing a 10% and they couldn't yet make it to past, a minute and a half, I'm not
Yeah.
going up the next time. I'm pushing them to 3 minutes the next time. Can I get them to 3 to 5 minutes? If I can get them
Just
there,
at the lower. Yeah.
yeah, then
Yeah.
then I'll say, okay, we've gone as far as we can with the 10%. Let's move up to 20 next time. And then we play with the timing. So it's like you've got your
Right. You
percentage,
go back
you've got your
down like, and again, you should be asking your client. That's something we haven't mentioned is from 1 to 10, what are they feeling? Like if they're needing a fan and oh my God, this is so much. And you're at 1 minute and you're at a 10%, then yeah, you're
yeah.
not doing a 35 or a 50.
And you also have to like read the peel. Like you got to see what's going on in the skin because I have a very low pain tolerance and some people have a higher pain tolerance. So
Yeah.
what could be a 4 for somebody, I would be like this is 8, right? So I
If
think
your
it's like
skin isn't red or pink, but it's just you.
right. Yeah.
Yes. And that's
But
exactly,
they
it's
can
reading it.
say, "Oh no, I don't feel anything." But if I'm seeing a bunch of reaction on the skin, I don't like we're
Yes.
gonna neutralize this peel now because you might not feel too much, but your skin is telling a different story.
And again, that goes back to the knowledge. Like, reverse that to people who have a high pain tolerance. So,
Yeah.
like 4 minutes in, like, oh, yeah, no, I'm still good. This feels great. But it's like, I think I'm going to stop. Like, it's that 3 minute mark kind of thing.
Yeah.
You're better off holding back that minute than pushing through because they could be a later response.
Yeah. Yeah.
And that's common too.
Yeah.
So again, like you said, you got to read the peel. That's what it's referring to. Watching what you see.
Yeah.
Who is your client? Their pain tolerance. What's happening? You know, Hopefully they're one of your clients you've had already, because then you kind of know their skin and probably how
Mhm.
they react.
Yeah.
It's like the people who you do, I don't know, an enzyme peel, you're steaming them, you do extractions, and everything's great. And after the mask, you take it off and you can see every spot that you did extractions on. Well, it didn't happen during, they were a late response. And that's what I'm kind of referring to when I say a later response time.
And I think that restraint is the word you use the word restraint, and that should be the word of your chemical peel experience. Restraint. You need to err on the side of caution and always do less
Yeah.
because
And
you
just tell
don't
your client,
want to cause
educate them.
damage. Yeah.
Yeah, educate your client that, I want you to have a regular life. We don't want to have any adverse effects. I know some people who unfortunately it's not as simple as saying, yes, you can do a 35% glycolic and sweep them and do it for hyperpigmentation, off they go. And then they have adverse effects.
Yeah.
Even though you were taught that yes, you can do it. However, you have to think of all the little pieces to this, and
Yeah.
less is more. And I can't help but keep pushing that side because I think people are just hung up on, but I want from the 35 as I graduate to the 50. Like
Mhm.
it's like, it's not about that. Like, don't think your goal is like, there's people who will go out and buy glycolic percentages, right? Say, well, why do you need the 50? You have the 35 already. You can build off of 35. Like, you don't have to go unless you're advertising and that's your big thing and you're focused on the high peels. You've missed the point of what peels are and treatments. I mean, I think,
100%.
yeah,
Yeah, I agree. And I think it's can you do it is a question, but should you do it is the better question.
yeah,
What else can you
exactly.
do?
Yeah,
How can you reach the goal with the least amount of post-treatment complications? You wanna make things better, not worse for your client.
yeah. The worst that could possibly happen is that you've got to send them to a doctor because now they have an
Is it
infection.
something you get? Yeah,
And it has happened. It's happened. And yes, you were told you could do 50 on hyperpigmentation, but should you? You're still going to be held accountable to you in the end, the person doing the treatment based
mhm,
on your education, you should know. So it's, again, I know sometimes people are just asking for a direct answer. Chemical peels have no direct answers, to be fair.
no. It depends. That's the
Yep,
answer.
there you go. But yes,
I
you can
think
do different peels on hyperpigmentation. They work wonderfully. Just remember all of those things we talked about, the prepping, the age, the genetics, the how it became, like how did they get it? How long have they had it? What's their future? What's their lifestyle? There's so many things to think about when you're doing this. But yes, it
yeah.
does help.
And I think another key thing is that if you find yourself unsure or constantly questioning, maybe your chemical peel training was during your full program, that it wasn't, you didn't dedicate, go take a class, like go take an advanced peel class. It's really good to get to get in depth on a topic if you're really interested in, being a provider of chemical peels, or if that you want that to be like your
Yeah,
area of expertise or whatever it is, like invest in your own education and see, get more training on it, more
yeah, it
in-depth.
never stops.
Yeah,
It's such a good point because you look at, okay, especially if you went to an aesthetic school, the likelihood of having the right candidate for the peel is unlikely
exactly.
because it's the season. They're how old? They probably don't have any hyperpigmentation yet. So
Hmm.
you didn't even get a chance to do it on anybody. And I think that's a big part is really understanding you need to stay on top with your education, and things are changing. Like back when I did peels the first time, I remember we got our hands on 30% glycolic. I was like, oh my God, we're allowed to do this? I'm going back a very long time ago. And it scared me because it's like, what, you can't just sell me this product. I need to know more. So
Yeah,
because it was so new in the esthetician's hands then, there was a lot more free training because they were trying to get it out there. Not
right.
everything's going to be free. So you got to look at this as an investment for yourself if you really want to dive into this. And I think that's a crucial part. And sometimes it takes more than one training to really get it. And that's okay. Be okay with it because you're going to learn something from it for sure. So I love that point during education. So important.
Yeah, always, always.
I think we got that covered. Hopefully, again, if you have questions or comments, you know how to reach us. We are here for you. Thanks for joining us.
Thanks for listening to Beauty Babble.